Okay. So let's start our discussion with the cardiovascular system. Let me just okay. So yay. And so let's begin with this video presentation of what happens with your cardiovascular system and its anatomical structure. So as you can see, the heart is your pump. Now the blood works as the delivery system, and the pathway is your arteries and blood vessels. So the heart is the one that is responsible in pumping blood. It is divided into right side, left side. Right side is your unoxygenated blood, and left side is your oxygenated blood. It is the one responsible in also making sure that gas does not mix. However, gas exchange occur through the process of diffusion. Okay, so the heart pumps about 5 liters of blood every minute, and this is approximately how many blood that yung amount of blood that a person has. It beats 100,000 beats per day, and of course 35 million beats per year, which means that your heart does not stop. Ito yung kumbaga sa sa lahat ng muscles in the body, it is the cardiac muscles that doesn't stop until unless you die, you know. So it's the one that is continuously moving, continuously pumping. Yan. Kaya minsan napapagod, 'di ba? Sabi nga ni Moira, ang puso ay napagod. Ayan. So that's why you need to make sure that the heart also rests. Now, how does the blood flow inside the heart? Now, this is quite important. This is something that I suggest you memorize. So the heart begins, the blood flow begins with your superior and inferior vena cava, draining the blood to the right side of the heart, specifically the right atrium. Okay, medyo lang, bumalik. Okay, so the right atrium is the first chamber of the heart. And then from the right atrium, it will now go to the tricuspid valve and to the right ventricle. Ayan. So may valve sa pagitan ng right atrium at right ventricle. It's called your tricuspid valve. So as you can see, this is blue blood, meaning signifying unoxygenated blood. And then it will now go to the pulmonic valve, to the only arteries that carry unoxygenated blood. This is your pulmonary arteries. Ayan. Hindi siya nakikisama. Yan. So your pulmonary arteries, doon pupunta yung unoxygenated blood natin. Once it goes to the pulmonary arteries, it will go to the lungs for oxygenation. Yan. So dadaanan niya yung pulmonic valve, then pulmonary arteries for oxygenation sa lungs. There will be gas exchange in your alveoli. Pagbalik niya, left side na ng puso, left atrium through the pulmonary veins. Now, the left atrium and left ventricle, sa gitna niya may valve, ang pangalan mitral valve, and it will go to your aortic valve, papunta sa aorta, which is the largest artery in the body. Now, in the left side of the heart, left ventricle specifically, is the largest chamber and has the highest pressure. It also has the most strength, no? Yung cardiac muscle mo sa left ventricle concentrated yung most strength niya, kasi dapat yung pumping ng left ventricles will cause the heart, will cause the blood to flow hanggang sa dulo ng mga blood vessels, ng mga arteries. So the pumping mechanism of the blood of the heart, makes it possible for oxygen to be delivered in the different cells of the body. Ayan. So it will go to your aorta, and the aorta is divided into 4 sections. You have your ascending, descending, and then your thoracic and abdominal aorta. Now, if you look at the valves na binanggit ko kanina sa inyo, you have 4 valves. Tricuspid valve is seen in between the right atrium and the right ventricle. So nasa right side siya. The mitral valve is seen between the left side, left atrium, and left ventricle. Okay? Together, tricuspid valve and mitral valve is also known as bicuspid kasi dalawa yung kanyang cusps. So, tricuspid and bicuspid valve. So both of these valves collectively are called atrioventricular valves or AV valves. Why are they called that way? Because they close and open simultaneously, and also they separate the atria and the ventricle. So they are called atrioventricular valves. Now the AV valves, upon their closure, makes a sound, and this sound is known as your S1 heart sound, and that is what we call as your lub. Yan. Now the pulmonary valve and the aortic valve comes before the structure na kapangalan niya. So the pulmonary valve is the structure before the pulmonary arteries, while the aortic valve is the structure before the aorta. Now these two are collectively called semilunar valves because they look like half moon shaped cusps. Yun yung pulmonary and aortic. They also close and open together, and semilunar valve's closure produces the S2 heart sound known as dub. So yung kanila, they are synchronous in closure and opening, thus causing the pumping mechanism of the heart as lub dub, lub dub, lub dub. So they only open when pressure is there. Now, another thing that you have to note about the heart is its resting phase rather, and its contracting phase. Now you have systole and diastole. Systole signifies the ventricular contractions, while diastole signifies the ventricular relaxation. As you can see, systolic pressure is always higher than diastolic pressure because ventricular contraction is always higher, that the pressure that it exerts is always higher than the relaxation that happens afterwards. So that's systolic and diastolic pressure, which signifies your BP. Another important thing that you have to know about the heart is your coronary arteries. Now, coronary arteries are the ones that supply blood to the heart muscles. So, ito ay directly connected sa iyong aorta at siya ang nagsusupply mismo sa puso ng dugo. And you know that the heart, kasi dahil napakalakas ng demand niya sa oxygen, kasi ang tindi ng trabaho niya. So that's why it gets the best oxygenated blood directly from the aorta. So that's the coronary arteries. Next portion that you have to know about the heart is that the heart responds to an electrical impulse and also has the ability to initiate one. Aside from that, it also is excitable, meaning it responds to an electrical impulse and also conducts electrical impulse from one place to the next. And this conduction system is beginning in your right atrium, high up the right atrium, specifically in your sinoatrial node, also known as your primary pacemaker. So the SA node, that's where it is, will now initiate the electricity, and the electricity will go to your internodal pathways. From the SA node, it will go to internodal pathways to your AV node, and the AV node is now your secondary pacemaker. So as you can see here. Then it will go to your bundle of His. Tapos maghihiwalay siya right and left bundle branches. And then hanggang sa dulo nun, which is Purkinje fibers. And this, once the electricity reaches that part, it will contract your ventricles. So this process, this continued process, is what makes sure that that life will be possible, because the blood is the one that carries oxygen, making life possible. It also carries waste. It carries your carbon dioxide, carries your nitrogenous waste, it carries your nutrition, it carries different immune factors. So yung blood mo talaga lahat yan. Protein, carries the protein. So it's the blood that makes it possible. Pero yung blood na yun, di yun madideliver unless meron kang pumping mechanism, which is your heart. Yun. So I hope that you have, you're able to actually grasp what I just said. So the cardiovascular system is a closed system, meaning, sabi ko nga sa inyo, the heart is its major organ, and the blood vessels are the Para kumbaga sa ano, it's the highway. Ayan. Yun yung mga daanan ng iyong dugo. The function of the cardiovascular system is more of transportation. So if you listen to or you want to know in one word, how can I summarize cardiovascular system's function? It's transportation. Ano mga tinatransport niya? Everything that your body needs, including oxygen, nutrients, hormones, pero tinatransport din niya lahat ng kailangan naman ng katawan mong tanggalin, like your wastes. So it transports all of this to and from the cells. Okay. Now, the heart, in essence, is the size of the human fist. And as you can see, it is located in the mediastinum, slightly to the left of its center. So the reason for that, so it's in the thoracic cavity, the reason why the left side actually, why the heart is actually slightly to the left side, it is because doon may space. Okay? Because the lungs, as you know, meron kang meron kang dalawang lungs, right and left. And on the right side ng lungs mo, merong tatlong lobes. Pero on the left side, dalawa lang yung lobes mo. And that missing lobe, or that portion is where your heart is located. Kasi kung parehong tatlo-tatlo yung lobe niya, mawawala ng space yung heart. So that's the reason why you have 3 lobes on the right and 2 lobes only on the left side of your heart. Now, when you talk about orientation, the apex is directed towards the left hip and rests on the diaphragm. Now, you know that the diaphragm is the major muscle for breathing, no? So kapag ka yung heart mo also rests on your diaphragm kasi yung lungs mo also rests on your diaphragm. So the base of the heart points towards the right shoulder. So as you can see, when we look at the heart, so here you have the left side of the heart only having 2 lobes. You have your right side, you have your side of the heart. So the lungs, the right side of the lungs having 3 lobes. Okay, so this is your heart. So as you can see, the apex, di ba? Yung positioning ng puso, para siyang medyo naka-lean. Ayan. Or parang, ano mo yun, relaxing. Ayan. So para siyang nakahiga na hindi fully nakahiga. No? So you can just imagine yung positioning ng heart. No? And then yung apex niya, which you can see in this picture, is actually found, as we've said, in the portion of, or rather, it's pointing towards the left hip. Okay? And then the right side, your base is actually pointing on the right shoulders. Okay? So this is now the positioning of the heart. And this is your diaphragm where it rests. Yan. So as you can see, pinakita ba niya yan? Pericardium. So the one that covers the heart, kita yan by the white side, a white lining, I think that represents the pericardium. So the pericardium is the one that covers the heart. So meron kang dalawang layers yan. You have your parietal and your visceral pericardium. Yan. And in between that, you have your pericardial sac. The pericardial sac is filled with fluid, and it also has may lubrication yung fluid na yon to make sure that when the heart pumps, hindi magkikiskisan yung mga layers ng iyong puso. Yan. Okay, so this is now, as you can see here, with regards to the ribs, okay? So slightly, so ito yung midline section natin, but the heart is slightly to the left of its center. And ang isang importante po dito is your it's your fifth intercostal space. So pag sinabi mo intercostal space, in between the ribs, so pag binilang mo 1, 2, 3, 4, 5. In your fifth intercostal space, let me just use my pointer. So, dito po, importante kasi ito binibilang natin. So, bibilangin mo yung, halimbawa, ikaw po may nakita kang patient and gusto mong mapakinggan ang kanyang heart rate at the point of maximal impulse or PMI or point of maximal intensity, bilangin mo yung ribs niya, yung pagitan. 1, 2, 3, 4, 5. So, in the fifth intercostal space, fifth ICS, okay? Fifth intercostal space on the left side, yan, left side, because it's here on the left side, you will hear your point of maximal impulse. Or ito yung, ano natin, PMI. So if you want to hear that, dito daw pinakamalakas yung heartbeat, no? If you're using a stethoscope and you're checking out the apical pulse, this is the point of maximal intensity. Fifth intercostal space on the left side. Okay. So this is the mediastinum. So this is a transverse cut of your heart, view. So you can see the heart, you can see the lungs. It's okay. So that's the right lung, left lung. Okay. So this is what I was trying to tell you earlier. So you have your pericardium, which is a double-walled sac, meaning it has two layers. And the first layer is your visceral, which is the one that is closest to the heart, and the other one is your parietal, which is the outside layer. Now, the visceral layer is also known as your epicardium. Yan. So the visceral pericardium is also known as your epicardium. Kasi ang heart natin may tatlong layers. You have your epicardium, you have your myocardium, and you have your endocardium. Now, as I've told you, in between the parietal and visceral pericardium, meron ka dyang fluid, and that fluid that is in between the layers of the pericardium is known as your pericardial cavity. Yan. So may mga pagkakataon na yung fluid na nandyan, dumadami, just in cases of patients having excessive water volume. So pag nangyari yon, meron kang risk for pericardial effusion. So dapat yung fluid layer, yung fluids dito is only enough. Yung fluid dapat enough. Pag tumataas, nagkakaroon ka ng pericardial effusion. So pag ang pasyente may pericardial effusion, halos hindi mo marinig ang heartbeat. So we call that as your quiet heart. Yeah. So pag pinakinggan mo sa stethoscope, bakit parang hindi ko marinig yung heartbeat ng patient ko? So it's possible na meron siyang pericardial effusion, kaya hindi masyadong marinig sa stethoscope yung heartbeat. Okay. So this is your, ayan. So this is, as you can see, closer view of the heart muscles hanggang pericardium. So as you can see, you have your parietal pericardium, which is the one that is outside. Then you have your pericardial cavity and yung may fluid. Then you have your visceral pericardium, also known as your epicardium. Then you have the muscle layer, myocardium. Then you have your endocardium, which is the one that comes in contact with the blood inside the chamber of the heart. Okay, so this is an example of that view. Okay, let's continue. What about the walls of the heart or the different layers of the heart? So you have their epicardium, which is, as we've said, the outside layer. It's also the visceral pericardium. The myocardium, the middle layer, which is cardiac muscle. And the endocardium, which is mostly endothelium. This is the one that comes in contact with the blood, directly contact with the blood in the different chambers of the heart. Okay. Ayan. Now, let's talk about the four chambers, which I already told you about earlier. So we will trace how the blood flows inside the heart, and we will try to memorize it. So from yung four chambers natin, we have left and right atrium, you have left and right ventricles. Now, obviously, atria, yan yung entry chamber. Ibig sabihin, they receive blood. Kasi sabi nga natin, from superior inferior vena cava, it goes to the right atrium. Tapos from the pulmonary veins, it goes to the left atrium naman. So in the atria, mas maliit yung pressure as compared to the ventricles. Now, the ventricles are your exit chambers, meaning they discharge yung blood from the heart. They are usually thick-walled, okay, and they propel the blood into the circulation during contractions. So, as I've told you, ayan, so ito yung kanyang action. The blood flows from the superior vena cava. Let me just use my highlighter. From the, no, not highlighter, the laser pointer. So from the superior vena cava and inferior vena cava, these are the largest veins in the body. So the blood will go to the right chamber of the heart, rather, right side of the heart, unang chamber ng puso, which is your right atrium. Now, once it's in the right atrium, the next step, so the tricuspid valve is here. Okay, it will now go to the tricuspid valve o open siya and will go to the right ventricle. Okay, this is your exit chamber. So, pansinin niyo po yung myocardium layer ng iyong ventricles. Di ba siya makapal? Ayan o. So, they're both makapal. Pati left ventricle. Siyempre, left ventricle pinakamakapal. So, because the myocardium, ayan, makapal, is imagine mo na mataas ang pressure. Okay? So from the right ventricle, it will go to your pulmonary valve. This is your pulmonary valve. So gusto ko pansinin mo siya because your pulmonary valve is semilunar valves. So pupunta na siya ngayon sa pulmonary artery, yung kulay blue dyan. So punta siya sa pulmonary artery. So sabi ko kasi inyo, most arteries carries oxygenated blood, except for the pulmonary artery, which you can see right here, na blue blood ang daladala, meaning unoxygenated. From that, the pulmonary arteries will connect inside your alveoli, yung mga where gas exchange occurs. So after the gas exchange, babalik na siya sa puso. So it is now the left and right pulmonary veins. Ito po yung left pulmonary veins, ayun po yung right pulmonary vein. So as you can see right here, okay, yan. So they now carry oxygenated blood. Pula na siya, right? So from the oxygenated blood na pulmonary veins, babalik siya ulit sa puso, entrance chamber ulit, which is the left atrium, the third chamber of the heart. Kaya siya tinag na entrance kasi lumabas sa puso yung dugo, babalik ulit sa puso. As you can see, manipis lang yung myocardium niya kasi maliit lang yung pressure. Then it will go to the mitral valve, also known as your bicuspid valve. Sorry sa dogs. Ayan, so the bicuspid valve, ayan, pupunta dyan yung iyong left, midnight, no. So it will go, this is where your blood will enter the left ventricle. Now, as I told you, the left ventricle has the highest pressure. And as you can see here, siya yung pinakamakapal yung myocardium, kaya siya yung pinakamataas yung pressure. Ayan, that's the left ventricle. Now, after the left ventricle pumps, the blood will go to the aortic valve. So this is your aortic valve, as you can see here. And it will go to the aorta, which is the largest artery in the body. So it will first go to their ascending aorta, and then ascending pataas sa ganon, descending aorta, thoracic aorta, and then you have yung pinakababa niya, abdominal aorta. Okay? So that is your heart and how the blood flows to it. So as you can see here, you will also see the different parts of the valves. So you can see your chordae tendineae, yan. Yung valves mo po, yan, naka-attach siya, yung pinaka cartilage niya, tinatawag natin chordae tendineae. Yan, kaya yan po yung nakalagay. Chordae tendineae. Yan, minsan tumitigas. Pag tumigas yung chordae tendineae, magkakaproblema ka sa valves. Magkakaroon ka ng valvular diseases. Yan. Yay! So, tingnan niyo po yung difference ng right side, right ventricle, at left ventricle. Okay? You will find there this very thick interventricular septum. Okay? It's very muscular. Yan. Ang macho ng puso natin, no? Kasi kailangan yung pumping mechanism niya is enough to make the blood flow throughout your body. So, atria, yung left and right, and your ventricles, merong nahihiwalay siya ng septum. So, yung septum, yan, it's the one that separates. So, pag atrial, it's the one that separates the two atria, the right from right and left. Interventricular, meaning right and left. So, septum is pagitan lang. Okay? So, ito yung septum. So, you have your interventricular septum, this one. And then you have your atrium, hindi siya masyadong kita, pero it's also separated by a septum. Okay. Dito. So, yan, sinaseparate niya nagkakaroon ng right and left chambers. So, as I've told you, the heart functions as a pump, and it functions as a double pump. Because the right side pumps blood towards the lungs, and then the left side pumps blood to the systemic circulation. So that is why, you have your double pumping mechanism. So arteries are the one that carries blood away from the heart, meaning they are actually the ones that carry oxygenated blood. And the veins are the ones that carry blood towards the heart, which means they carry unoxygenated blood. Okay? So as I told you, you have to memorize your flow of blood sa puso. So let's do that. So let's trace that once again. So from the superior and inferior vena cava. So superior and inferior vena cava, the blood flows to the right atrium. From the right atrium, it will go to the tricuspid valve. From the tricuspid valve, right ventricle. Madali lang po siyang sa uluhin. Ventricle. From the right ventricle, papasok siya sa pulmonary valve, then pulmonary arteries. Then it will go to the lungs for oxygenation. From here on out, it will now carry oxygenated blood. So it will go to the pulmonary veins. From that, it will go back to the heart, left atrium. It will now enter the valves through your bicuspid valve or mitral valve. Okay. Pwede rin bicuspid. Then to the largest chamber of the heart, left ventricle. Then from the left ventricle, punta siya sa aortic valve. From the aortic valve, aorta. And then to the systemic circulation, which means different cells of the body. So dito sa lungs na to, dito yung pulmonary circulation. Yeah. So that's how you memorize how the blood flows through the heart. Okay. So the pulmonary circulation, as we've said, is the blood flows from the right side to the lungs and then back to the left side. Okay. So the pulmonary arteries are the one that takes the unoxygenated blood towards the heart, and then the pulmonary veins carry the oxygen-rich blood or oxygenated blood. Now, in the systemic circulation, alam natin that oxygenated blood will now go to the left side of the heart and will be pumped out of the aorta. So from that, syempre pupunta yan sa iba't ibang cells ng katawan, and then the oxygenated blood will be carried by the veins papunta sa superior or inferior vena cava. And then the cycle continues. Chanan! So you have this in the heart. So you have the right side, pupunta sa pulmonary circuits, then pulmonary veins, then balik sa left side, and then, ayan na, oxygen-rich yan. Aorta, different cells, nagamit na, carbon dioxide na yung bitbit niya, balik ulit dun sa puso for oxygenation sa lungs. Okay, so heart valves. So as I told you, the heart valves make sure that the blood flows only in one direction. Ibig sabihin, bawal ang backflow. Kaya kanina nakita nyo, no, closure and opening nila, synchronous sila sa closure and opening, making sure that the blood will only go one way. Okay. Ito na yung binabanggit ko sa inyo kanina. So the AV valves, which include your your mitral valve and your tricuspid valve are the ones that open and close. Yeah, so they're open during heart relaxation when blood passively fills the chamber. Okay? So this is during diastole. So pag diastole, yung AV valves mo bubukas. Okay? And then, close sila kapag systole, which is the ventricular contraction. Bakit sila nag-close? Para make sure na yung pumping ng ventricles, yung blood, hindi babalik sa atria. Dapat palabas ng puso. Okay? So, yan po yung AV valves. Then, you have your semilunar valves, which includes your pulmonic or pulmonary valve and your aortic valve. So, they're closed during heart relaxation and are open during ventricular contraction. Diba, as you can see, opposite siya ng AV valves. So, ang semilunar valves kasi, syempre, dapat close siya during heart relaxation para yung blood ma-fill up niya yung mga ventricles. Kasi close yung semilunar. So, if you recall, wait lang. Let me write it down. Let me draw it. Wow, draw. So, if you recall, so, ang ganda ng puso ko po. Ayan. Ayan yung valves. Ayan yung chamber. Tapos, let's say may valves ka dyan para pumunta siya sa pulmonary. Ba't ganyan yung valves ko? Ayan. Let me just, ayan. Halimbawa, ganyan po, no? So, halimbawa, this is your heart. So, let's say, for example, let me change my pen color. Let's say, for example, ayan, ito yung blood mo. Unoxygenated blood. Now, during ventricular relaxation, this should open, no? Mag-open dapat tong valve na to para makapasok yung blood dito. Yan. Ano bang valve to? Ito ay tricuspid valve. No, on the right, kasi unoxygenated. So, open siya, okay, during relaxation, okay, and the relaxation is your diastole. Tapos, ito, closed siya dapat. This should be closed, which is your pulmonary valve. Ma'am, bakit siya dapat closed? Para yung dugo, diretso dito, okay, tapos ma-feel niya to. Tapos, ito ngayon, ma-empty, okay? So, that is supposed to be what will happen as I've shown you earlier. So, dapat ma-empty yung atria, tapos yung iyong valve, ayan. So, dapat i-empty natin yan. Empty. Yarn. So, empty siya, tapos mapupuno yon. So, during that time, close po yung iyong pulmonary artery, which is your semilunar valve. And then, afterwards, syempre, mag-aano na siya, magpa-pump na. So, in the pumping mechanism, so, buray natin. So, during the pumping mechanism of the heart, so what will happen here is that, balik natin yung chamber. Ito na ngayon, dapat close. Okay. Close natin. Kasi andito na yung heart, yung blood. Para pag-pump niya, diretso na po sa lungs. So, ito, o-open siya. Open na ngayon yung iyong pulmonary or yung pulmonary valve. Ito naman ang close para hindi magba-backflow yung blood sa atria. Diretso lahat dapat siya sa lungs. Okay, so those are the actions of your AV valves and semilunar valves. So if you have questions, you can just unmute because I cannot see you if you have questions. No? So the atrioventricular valves, sabi ko nga sa inyo kanina, dalawang klase yung AV valves mo. Tricuspid, okay, and bicuspid or mitral valve. Yan. Pag semilunar, pulmonary valves and aortic valves. Ganon. Okay. Yon. So, eto po yung operation of the AV. Meron pala. Nakakatawa. So, this is the operation of the AV valves. So, it begins by the blood returning to the atria, which puts pressure against the AV valves. Now, the AV valves are forced open. So, as you can see here, okay, pupunta na siya, galing siya sa labas. So, from the atria, may pressure, bukas ang valve. So as the ventricles fill, so pupunta na siya dito sa ventricles, the valves, AV valve cusps hang limply into the ventricles, as you can see here. Okay? Now, the atria will then contract, forcing additional blood into the ventricles. So, pupunta po dito ang blood, magpupull doon. AV valves open, as you can see here, because of the greater pressure. Okay. Now, once the ventricles are filled with blood, ayan na. Okay. So, now it forces, so the AV cusps will now, ito yon yung AV cusps, yung iyong pulmonary and aortic, will now open. Kasi puno na to. So, ito ngayon, yung, wait lang, kunin ko yung aking laser pointer. As you can see, ito ang magbubukas na next. Itong dalawa. Which is your AV, what do you call this? Your semilunar valves. Okay, your semilunar valves will open na. Pero yung AV valves, sarado na. Okay? That making sure that the blood is here. So once the pumping mechanism happens, the chordae tendinate tightens, preventing the valve cusp from everting into the atria. So as you can see here, ito yung chordae tendinae mo. Okay. So it will now prevent your blood from regurgitating. Yan yung function niya. Now, what about the semilunar valves? So once the ventricles now are filled with blood, it will force your semilunar valves to open. Yan, open siya. And that is now, so that will cause the blood to be pumped out of the body, or rather out of the heart, and it will also make sure that the blood stays there by closing it off. So, ayan. So, as you can see here, close na siya. So, the blood will go there, close itong dalawa. Okay? So, that is now the pumping mechanism. Yan. Or the mechanism of the semilunar valves. Yan. Okay, so the blood in the heart chamber does not nourish the myocardium because it has its own nourishment, which is the coronary arteries. So, the coronary arteries are the ones that carry oxygen-rich blood from the aorta directly to the heart muscles. The cardiac veins, on the other hand, are the ones that gets the blood from the myocardium, yung unoxygenated blood, na nakakonect sa coronary sinus. And coronary sinus is the one that directs it sa iyong right atrium. Okay. So, ito po makikita nyo ang iyong mga iba't ibang coronary arteries. So, you have your right coronary artery. You have your left coronary artery. You have your circumflex artery here. Okay, so they are the ones. So, all of your coronary arteries collectively are the ones that give oxygenation to the myocardium, the muscle. Now, the veins that you can see here these are your coronary veins. Now, the veins carries the blood away from the myocardium into the coronary sinus. No? So, kukunin niya yan lahat and then i-drain yan sa right side of the heart, sa right atrium. Okay. Suppose, intrinsic conduction system. Nabanggit ko to sa inyo kanina that the conduction system of the heart begins, so there's a conduction system of the heart and it begins high up your sinoatrial node. So, your cardiac muscles respond to the conduction of the electrical impulse inside the heart. Actually, you can measure this through the use of ECG, which is your electrocardiogram. So your atria, yung sinoatrial node, yan ang yung primary pacemaker and gives you, as we've said, about 60 to 100 beats per minute. Your ventricular cells, however, can only give 20 to 40 beats per minute, which is the AV node, no? 20 to 40 beats per minute lang. Okay, so this is your heart's regulation, yung heart rate natin is regulated automatically. So, ibig sabihin, it is the brain that actually regulates it, the part of the brain which is autonomic nervous system, meaning you don't think about it, it is not voluntary, it is involuntarily regulated. Okay, so the the conduction system is one of the it's one that sets the rhythm of the heart. Now, because of your process of depolarization, it enforces about 75 beats per minute. So let's trace that pathway of depolarization. So sabi natin, it begins high up, your right atrium, which is your sinoatrial node, SA node, and it will go to the internodal pathways papunta sa yung AV node, known as your atrioventricular node, which is found in the junction. Then it will go to your AV bundle, also known as the bundle of keys. Okay, and then it will branch out into your right and left bundle branches hanggang makarating yun sa iyong Purkinje fibers, which is the one responsible in contracting the ventricles. So that is now your pathway of depolarization, or this is how your heart muscle eventually contracts yung left and right ventricles. Yan. So ito yung SA node mo. From that, it controls the heartbeat, no? Kasi siya yung nagbibigay ng initial impulse. So from that, it will go to your AV node. So may internodal pathway ka dito. Then it will go to your AV node. And then hanggang sa bundle of keys, maghihiwalay siya right and left bundle branches. Then yung pinakadulo niya, Purkinje fibers. And the Purkinje fibers, once the electrical impulse reaches the heart muscles, okay, it will now contract. So this is known as the pathway of depolarization or the conduction system of the heart. Ayan. So it's the same, yun ang binanggit ko kanina. Now, more than 100 beats per minute, it's considered tachycardia, and less than 60 beats per minute, it's considered bradycardia, meaning mabagal masyado ang iyong heartbeat. Okay, when we talk about cardiac cycle, ito nababanggit ko na kanina, you have systole, and diastole. Pag sinabi mong systole, it's the contraction. It's always higher in pressure than the relaxation, which is your diastole. That's why when you record your blood pressure, yung numerator mo is always higher than the denominator, because the numerator corresponds to the systolic pressure, while the denominator corresponds to diastole, which is your relaxation. So a cardiac cycle, meaning contraction and relaxation, lasts for about 0.8 seconds. 0.8 seconds. Kaya nga, nakaka-75 beats per minute ka, di ba? Sa isang minuto, may 60 seconds. So the cardiac cycle, so ito yung nangyayari, no? So the atrial diastole or ventricular feeling. So the heart becomes relaxed, okay? So kasi getting ready for the pumping again. The pressure in the heart is low during this time because this is your diastole. Atrioventricular valves are open kasi nagpupull yung blood doon sa ventricles, while the semilunar valves are closed para hindi lumabas yung blood. Dapat magpull lang siya sa ventricles. So the blood flows passively into the atria and from the atria into the ventricles. Yan. Now, in your atrial systole, okay, so ibig sabihin ito yung pumping mechanism. So the atria now pumps, contracts. So it forces the blood to the ventricles, thus completing the ventricular feeling. After that, you will have your ventricular systole. So isovolumetric contraction, so atrial systole ends and ventricular systole begins. Okay? During this time, the intraventricular pressure rises, the AV valves are closed. So for a moment, the ventricles are completely closed chambers. So nandun lang yung blood sa ventricles. Now, after that, ipupush out niya yun. So the ventricular systole, also known as the ejection phase, is where your ventricles will push open the valves, the semilunar valves, will cause the blood to be ejected from the ventricles, which means that during this time, the atria is just chilling out and filling with blood. Okay, so the isovolumetric relaxation, meaning the ventricular relaxation begins during this time. The semilunar valves closes and the ventricles are now closed. The atria is now being filled. Ayan. Tumataas na yung pressure sa iyong atria. Yan. So as I've told you, the lub-dub sounds. So the lub is the closure of the AV valves, while the dub sound is the closure of the semilunar valves. Yan. Lub-dub, lub-dub. Yan. Yan, that's the process. Cardiac output. So cardiac output is computed as the amount of blood pumped by each of your, by the heart in 1 minute. Yan. Amount of blood pumped by the heart in 1 minute is known as your cardiac output. Stroke volume, on the other hand, is known as the amount of blood pumped by the heart for every heartbeat. And of course, your heart rate is ito yung amount of pumping or how many contractions of the heart in 1 minute. So to compute for the cardiac output, we multiply stroke volume times heart rate para malaman mo ilang ml ng dugo ang na-pumped out ng iyong puso. So that's the formula. So example, you have heart rate is 75 beats per minute and your stroke volume is 70 ml per beat. Yan. So minultiply yon. So ang cardiac output niya is 5,250 ml per minute or 5.25 liters per minute, which is the normal cardiac output. Normal cardiac output is 5 liters per minute. Okay. Okay, so this is regulation of stroke volume. 60% of volume or blood in the ventricles, which is about 70 ml, is pumped with each heartbeat. Okay. So Starling's law of the heart, the critical factor controlling SV, stroke volume, is how much cardiac muscle is stretched. Now, Starling's law is what is implied. So the more stretched the cardiac muscle, the stronger the contraction. So this is the power of contractility. So yun yung Starling's law of the heart. Ayan. So according to him, mas magandang contractility, mas magandang or mas malakas ang contraction. Or mas stretch ang puso, mas malakas yung pumping mechanism. Because just like any pump, the heart works like a pump, as we've said. So I don't know if you have ever tried magbomba ng poso. Diba? Pagka ang pagbobomba mo ng poso is very, alam mo yon, yung mula taas hanggang dulo, yung pagbomba mo ng poso. Ibig sabihin, tinataas mo, tapos binababa mo talaga yung pumping, yung ano niya, yung ang tawag dun sa pump ng poso. Basta ganon. Mas maraming lumalabas na water. Pero kapag yung ano mo yung tinatamad ka, pero paano hindi mo fully pump yung poso, ang mangyayari, onti-onti lang yung labas ng water. Same thing with the Starling's law. No? So, the more stretched the muscles, the better the contraction. Okay. Next is, ayan. So, these are the ones that modify your heart rate. So, you have your autonomic nervous system controls. So, your sympathetic nervous system speeds your heart rate. And your parasympathetic nervous system, especially your vagal nerve stimulation, slows down your heart rate. Now, the vagus nerve is actually is found in your neck. So, it's possible kapag na-try nyo naman mag-close neck, turtleneck, masyadong masikip na what they call this, na necktie, yung mga ganyan. So, if you do that, and there's a tendency yung vagus nerve mo pwedeng ma-stimulate, and that will cause bradycardia. Kaya sa mga pasyente na masyadong mabilis yung heartbeat, kapag ikaw pwede rin to, pag nangyari sa'yo, pag masyadong mabilis yung heartbeat mo, you can do some neck massage. Neck massage. Kasi pag ginawa mo yung neck massage, it will stimulate the vagus nerve, babagal ang heart rate mo. Okay? So next, you have your hormones. So there are several hormones that causes SNS stimulation that also speeds up your heart rate. Example of these hormones are your epinephrine, which is also known as your adrenaline. Yan, di ba? Kapag sumakay ka ng roller coaster, yan. Na-miss ko na. Okay. So kapag ka, ano pa, yon. So, bawa bungee jumping, hindi ko pa na-try, pero yon. So, mga nagzi-zipline, ano ko, ano pa mga ano nyo. So, nagre-release siya ng adrenaline or epinephrine from the adrenal glands. Then, it will speed up your heart rate. Diba? Kaya kami kinakabahan ka. Ganyan. Thyroxine, on the other hand, is your T4. It is your thyroid hormone. So, your thyroid hormone will also speed up your heart rate kasi it's responsible for metabolism. So, yeah. So also your sodium, potassium, and even lack of or excess of calcium can also affect your heart rate in different ways. Physical factors also influence heart rate like age, gender, exercise, body temperature. So all of this affects your heart rate. So it's like known that as you age, medyo bumabagal yung heart rate. Your gender, pagka males, mas mabilis yung heart rate. Pag pregnant, however, bumibilis yung heart rate. So exercise, so when you do exercise, mas mabilis yung heart rate. Actually, meron ka nire-reach na maximum adult heart rate. Yan. So based on your age. Yan. So this is an example of what happens, what increases or decreases your heart rate. Yan. So as you can see here, may mga triggers. So, pag may stress ka, pag masyadong mababa ang blood pressure, halimbawa, meron kang, let's say for example, na baril ka, halimbawa lang, may bleeding ka, bumaba yung blood pressure, manggagawin ng heart mo, tataasan niya yung rate. Okay, so, that is what will happen. Okay, let's now go to your, you can browse that over. Let's now go to your blood vessels. Now, when we talk about blood vessels, so you have arteries, veins, and capillaries. So, arteries are the ones that carry blood away from the heart. Your veins and venules are the ones that carries blood towards the heart. And, of course, what connects the two, where gas exchange occurs, are your capillaries. Okay. So, the blood vessels have 3 layers. So, you have your tunica intima, which is the endothelial lining. It's the one that comes in contact with your blood. Next, your tunica media, it's the one that controls kung vasodilation or vasoconstriction. And it's made up of smooth muscle. So, mas makapal ang tunica media ng iyong arteries kesa sa veins. Kasi mas mataas yung pressure doon. Next is your tunica externa. It's the external coating or protective lining of the blood vessel. Okay. So, under the microscope, the arteries look like this and the veins look like that. So, as you can see, ang kapal ng tunica media ng arteries as compared to your veins. Yan. So, this is what it looks like. So, you have your tunica intima. It's the endothelial lining. It comes in contact with the blood directly. So, ibig sabihin, yung pressure ng blood against the endothelial lining is what is called your blood pressure. Yan. So, you have there your tunica media. So, that's mostly smooth muscle. So, as you can see, mas makapal yung sa artery kasi sa vein. And as you can also see, ang tunica media ang responsible for elasticity, which means it's the one responsible for vasodilation and vasoconstriction. The tunica externa, it's the outermost. It is mostly protective of your artery and vein. And yung nasa baba, yan yung capillaries. So, you have endothelial cells and basal membrane. Napakaliliit kasi nila para ma-distinguish yung iba't ibang layers. So, the smaller arteries are known as arterioles and the smaller veins are known as venule. Yan lang. Yan. So, arteries are heavier, stronger, stretchier, tunica media than veins kasi higher pressure. Kaya nga po, ang arteries natin usually hindi ang kinukuhanan ng blood. Ang pagkuha ng blood laging sa veins. Pati yung swero mo, nilalagay yan sa veins. Kasi pag sa arteries, pag nakat yung artery, magkakaroon ka ng arterial spray. No? I don't know kung mahilig kayo manood ng mga movies na may ano no, yung sumisirit yung blood niya pag arterial spray. Pag artery siya nadali kasi may blood pressure. Okay, mataas yung pressure. Pag veins naman, ayan, the veins work by preventing the backflow of blood to the heart, syempre. So it's the one that causes blood to go towards the heart. Lumen of veins is larger than that of arteries. Ayan, because, ang gawa, pero lower pressure. Yan. Lower pressure lang ang veins. Now, the reason why blood flows through the arteries is the pumping mechanism of the heart. But the reason why blood flows through the veins is because of your skeletal muscle movement. As you can see in the lowest part of the PowerPoint, skeletal muscle milks blood in veins towards the heart. Meaning, yung contraction ng iyong mga skeletal muscles is the reason why blood flows through the veins. Which means kung hindi ka gumagalaw, magkakaproblema tayo. Kasi magkakaroon ka ng blood stasis. Yung dugo, magsistay siya doon sa veins, magpupull doon sa veins. So, kailangan meron kang skeletal muscle movement. So, paano may mga paralyzed? That's the reason why we do range of motion exercises. Di ba sa mga paralyzed, nakikita niyo yung mga PT o kaya yung mga nurse, pupunta doon sa bedside ng patient, tapos i-exercise siya. Ang purpose doon is for circulation, to make sure that the blood flows naturally and very well doon sa veins, no? So that is, yan. So yan yung nangyayari dyan. Yeah. So this is an example. So your vein has your valves. Yan, valves. So during muscle contraction, the blood is flow. Kasi remember yung veins mo usually against gravity. Hindi niyo napapansin, the blood flows through the veins against gravity para bumalik sa puso. Kasi bawa ito legs mo, di ba? So kailangan may contraction yung muscles para yung pag-contract ng muscle na yon will push the blood and push open the valves, no? Pag nag-contract siya, yan. So babalik sa puso, no? Galing. So sana na-enjoy niyo yung mga sound effects ko. Okay, let's continue. So for the capillaries naman, one cell layer lang siya, the tunica intima, may purpose yon. Kasi this is where gas exchange happens, no? So para yung lining niya, manipis lang, para magkaroon ng diffusion, mabilis na diffusion. Ayan. So the true capillaries branch off at the terminal arteriole and empty directly in your venule. So entrances to capillary beds are guarded by pre-capillary sphincters. So there are also sphincters pero inaalaw naman niya ang diffusion to occur. Chanan! Ayan. So this is your capillaries. So they connect your arteries and your veins. Yon, blood flow. Okay. Aorta. So, major arteries in the systemic circulation. As I told you, the aorta is one of those major arteries. And this is the largest artery. And ito yung nakakonect sa left ventricle. So, you have your ascending aorta, aortic arch. Yan, sometimes called descending aorta. Then you have your thoracic aorta and then your abdominal aorta. Yan. Binalik lang dyan. Okay, some of the arteries also of the body, can find it here. And I'm not going to ask you to memorize all of those arteries, but I'm going to ask you to memorize the pulses. Yan. So yung pag-pump ng blood and the pressure of the blood towards different sites causes you to have a pulse or pulso. Yan. So yun ang pag-uusapan natin, pulses. So this is just your different aortic arch, so arterial branches. So I'm not going to discuss that anymore. Yan. However, yan. So ito yon, pero I'm not going to discuss that. And then you have your major veins in your circulation. Chanan! Sobrang dami. I'm not going to ask you to memorize that either. Pero as probably as we go to the different parts pa po ng inyong anatomy, we will, describe some of this. Pero ang i-discuss natin, yung mga pili, yung mga ginagamit talaga, which will include your different pulse sites. Ayun, tingnan natin. So we'll go there. But I gave you also the this this different pictures so that you can know the illustration, you can know or you can visualize na sobrang dami nating arteries and veins. So this is now your artery inside the brain. Yan. So very important because as you can see, the brain needs a lot of oxygen as well. So you have here, I want you to see the circle of Willis. Yan. So this is known as the cerebral arterial circle. Okay. Yan yan. And this is where most, now I'm not gonna say all, but most of your strokes happen. It's in the middle cerebral artery. Ito po siya. This one that you can see here, the middle cerebral artery is where most strokes happen. This is where most strokes happen. Middle cerebral artery. And if that's the case, influenced niyan yung iyong optic chiasm, which means that vision is affected when you have a stroke as well. No? So, yeah. Okay. So we will go to the different parts of the brain when we talk about the nervous system. Ooh, this is how it looks like under your fluorescence. So the blood vessels, so you have your hepatic portal circulation. So dyan po, yan ang nag-oxygenate naman ng iyong major accessory organs. Like your liver. Major organ yan. Kasi the liver filters, or it's the one that is responsible in all of the, what do you call this? Synthesizing of your different substances. Yan, liver. So this is the portal circulation. As you can see, you have there, this is the liver. Yan. So hepatic circulation. This is the portal vein. Okay. There you go. This is the gallbladder. This is your stomach. This one is your pancreas. Okay. So lahat yan nagdo-drain sa yung small intestine in your duodenum. Small intestine, large intestine. Okay. Okay, yes, vital signs. Now, in the physiology of circulation, tayo bilang mga healthcare providers, one of the things that we have to figure out is the vital signs. And that's exactly why we study this, because we want to understand the anatomy behind the physiology. So you have your pulses, as I've told you. So the normal pulse is about the range of 60 to 100 beats per minute, less than 60 bradycardia, greater than 100 is your tachycardia. So the reason why you have pulses is because of the wave of the blood that parang comes in contact with the different pulse sites. Yan. So this is what you need to memorize, your different pulse sites. If we are face to face, I'm gonna ask you to locate your seatmate's pulse site, and then you will be able, yun, tas kapag na-locate mo na, then isasabihin mo sa akin kung saan, tas titignan natin kung nandun nga. Okay. So let's look at the different pulse sites. So first is your temporal artery. Temporal artery. So in your temporal artery, you will have their temporal pulse. Can you do that? Can you locate it? Can you put your fingertips, two of your fingertips, in your temporal area? Yan, sa side ng forehead. And palpate. So kung meron kang family member dyan na malapit, hatakin mo, palpate mo na. Hanapin mo ang kanyang temporal artery. Dapat mararamdaman mo yan. Actually, you have that in the right side and the left side, pero wag mong sabay na i-assess. Isa-isa lang. Can you feel it? Okay. Yes, good. So next up, you check. Okay na? So the next thing that we check is your carotid artery. Very important when you do CPR. Nasa leeg yan. Can you feel it? Huwag mong sabay papalpate. Pag sinabay mong palpate yan, pwede kang mahimatay. Okay? Kasi yung carotid artery delivers blood papunta sa brain. So kapag ka na-impede yung circulation, pwede kang mahimatay. Ma-loss ng consciousness. Can you feel your carotid artery?
Yes po.
Malakas ba? Pero felt naman. Sa iba kasi, hindi nila yan makapa. If you're not trained, it's quite difficult na makapa yung carotid artery. So the next one is your brachial artery. So sa antecubital area, yan, pakikapa ang brachial artery. Can you feel it? Brachial artery?
Apo.
Okay, good. Next is your radial artery. Yan ngayon ang pinaka-importante na alam mong kapain. So, nasan po ba ang radius? So, yung radius mo, yun yung nasa malapit sa thumb. That's your radial artery. Kasi kailangan alam mong kapain yan. Bakit? Kasi po, yan ang kinakapa mo pagka ikaw ay nagpa-pulse rate sa pasyente mo. Radial artery. Kaya yung iba, baka hindi nyo mahanap kasi ang ginagamit nyo, finger pads. Huwag yung matabang portion ng iyong daliri ang gamitin mo panghanap. Ang gamitin mo, fingertips. Yung dulo. Pagka ikaw nag-check ng sarili mong pulse, huwag ka huminga muna. Kasi naririnig mo yung sarili mong breathing. Yan, makakapa mo na. Mas magiging sensitive. Pagka ibang tao, yan, mas madali mong makapa. Kesa sa sarili mo. Next is your femoral. Ayan. So, huwag nyo nakapain. Baka magulat yung kasamahan nyo sa bahay. Ano bang ginagawa mo? Akala ko ba nagkaklase ka at kakaiba? Yan. So, femoral artery, yan po ay nasa singit. Okay? And then you have your popliteal. Yan, kapain mo siya. Popliteal, nasa likod ng tuhod. Popliteal artery. Popliteal pulse. Can you feel it? Anyone? Nakahanap na? Wala? Popliteal artery? Likod ng tuhod.
Meron po.
Okay, good. Next is your posterior tibialis. So the posterior tibialis, it's located sa may ankle. Posterior tibialis. Can you feel it? Yeah, I felt it. And lastly, sa ibabaw ng paa mo, dorsalis pedis. When I was a student, ito yung nabunot ko kasi bunutan yun eh. Bubunot ka ng pulse na kakapain mo sa partner mo. Nabunot ko dorsalis pedis. Yung classmate ko, ayaw niyang hubarin. Ayaw niya hubarin yung shoes niya. Sabi ko, uy, hubarin mo. Paano ko makakapa? Ma'am, hiyang-hiya siya dun sa teacher namin. Sabi ko, bakit kaya? Nung pagbabad niya ng medyas niya, alam ko na kung bakit siya hiyang-hiya. Alam mo yan, can you imagine? yung kaklase mo may athlete's foot, tapos sinahanap mo yung dorsalis pedis. Hindi ko pa makapa, agad-agad. So, syempre, ilalapit ko pa yung mukha ko doon sa dorsalis pedis niya. So, good luck naman. Yan. So, yan. Buti hindi tayo face-to-face, kundi magkakaamuyan tayo niyan. Okay. So, let's now go to... So, guys, memorize this yung mga pulse site na yan, kung nasan yan. Okay? Actually, meron ko pang ibang mga arterial pulse site, pero yun yung common. Facial artery, hindi nga yan check eh. Hindi yan common, yung facial artery. Ulnar pulse pa, check. So, yung ulnar pulse, yun yung opposite the radial artery, yung sa side ng pinky mo, that is your ulnar pulse. Okay. Blood pressure. So, I've told you this before. That's the pressure of the blood exerts against the arterial walls. Yan. So, obviously, meron nagko-control ng pressure. Usually, higher pulse rate causes higher pressure. Okay? So, when the ventricles contract, blood is forced out, which means that higher pressure ang kapag systolic and lesser pressure pag diastolic. Okay. So, this is your systolic pressure. Yan, as you can see. And then you have your diastolic pressure or relaxation pressure. Okay. So the normal blood pressure is 120 over 80. Yan yung ating normal blood pressure. So it's measured by millimeters of mercury. Okay, so yan ang measurement natin. So yung expression ng ating systolic and diastolic pressure. Okay. So this is now your blood pressure. So 120 over 70. Ayan. So the brachial artery of the arm assumes a blood pressure of 120 over 70. Ayan. So this is your BP cuff. So as you can see, this is now your sphygmomanometer. So ginagamit natin to check the blood pressure. So paano ba yon ginagawa? So you inflate the cuff hanggang mawala na yung kanyang pulse. No? Ako, check ko dito radial pulse. So I will inflate the cuff so until mawala yung kanyang radial pulse. And then I'm gonna release it. So meron akong stethoscope. So ilalagay ko yon over the brachial artery, and then I'm gonna listen for sound. And that sound actually is known as your Korotkov sound. Yan ang sound ng blood pressure. Korotkov. Social. We call that as your Korotkov sound. Wait lang. Ayusin ko itong aking. Yan. Korotkov. I'm gonna write it down. So the one that you hear, the audible sound in the stethoscope, is known as your Korotkov sounds. So yung pinakaunang Korotkov sound, that will be your systolic. And then yung pinaka-last na audible, it's the diastolic. Korotkov sound. Okay, so how do you measure blood pressure when you have cardiac output and pulse rate? So remember, sabi natin kanina, cardiac output is your stroke volume times your heart rate. Now, your blood pressure, on the other hand, is your cardiac output times your pulse rate. Yan ang computation. Okay. So what are the factors that affect your blood pressure? So you have your neural factors, meaning your autonomic nervous system. The parasympathetic nervous system does not affect or pwedeng decrease blood pressure. Pero yung sympathetic nervous system, it increases your BP. Okay? Causing vasoconstriction. Okay, so your kidneys also affect your blood pressure kasi dun sa kidneys mo, meron kang specialized hormone that actually is released every time the pressure is low or high. So once the pressure is high, the kidneys will expel more water out of the urine. But when the pressure is low, it will trigger a system known as renin-angiotensin aldosterone mechanism. Some will refer to this as your RAAS. So when BP is low, it will trigger your RAAS. So RAAS is also known as your renin-angiotensin aldosterone system. Angiotensin aldosterone system. So, ang purpose niyan ay i-elevate yung masyado mong mababang blood pressure with the use of your hormone releases, which is renin, angiotensin, converting it to angiotensin 2, and then your aldosterone. So, temperature, so heat has a vasodilating effect, causing a decreased BP, while cold has a vasoconstricting effect, which increases your blood pressure. As for chemicals, so different chemicals increase and decrease BP. It depends on that chemical or that medication. So pag mga SNS stimulants like your adrenaline, it increases your blood pressure and also increases your pulse. Of course, food also affects your blood pressure. So alam natin yan, kaya ang mga high blood mo na mga lolo't lola or parents, di ba naka-diet sila na low salt kasi nga low fat at saka low cholesterol kasi it actually causes hypertension kapag mataas ang salt, pag mataas ang cholesterol at fats ng dugo. Obviously, viscosity of the blood is also a factor. Wala dito. Pag malapot ang dugo mo, mas mataas ang pressure nito na kailangan para i-pump ito. Just like in patients with diabetes. Yan. So, yan. So, the normal human range of variation, 110 to 140 and 70 to 80 diastolic. So, if it's less than that, pwedeng hypotension. Greater than that, hypertension. So, hypotension is a low systolic pressure of less than 100 millimeter mercury. So, pag ikaw, ang BP mo 90/60, ganyan. So, it can be hypotension. It can be associated with illness or it can be a sign of shock, which is your hypovolemic shock or circulatory shock. So, that's how you have to measure blood pressure appropriately. So, hypertension naman, so sustained elevation, ibig sabihin hindi lang one instance na na-take mo yung BP mo, tapos mataas talaga. So, this is hypertension. Ang problema mo, hypertension can lead to further damages like your coronary artery disease, it can lead to stroke, it can lead to different diseases like myocardial infarction, kasi yung endothelial lining mo nasisira. Okay, so hypertension is obviously bad for the arteries and veins. Okay, so capillary exchange of blood, of gases and nutrients. So substances take different routes. So ito through the process of diffusion, syempre na-deliver siya sa different cells of the body. It's all about diffusion. So the pressure, so the fluid movement is caused by different pressure. So we have your osmotic pressure and oncotic pressure. So pag sabi mo osmotic pressure, something to do with the solute level. So depende sa dami ng solute dun sa area na yon, dun napupunta yung mga fluids ng dugo. Okay? So for blood pressure is higher than osmotic pressure at the arterial end of the capillary beds, while BP is lower than osmotic pressure at the venous end of the capillary bed. So as you know already, that BP is higher in the arterial end and BP is lower in the venous end. Okay. This is just developmental aspects of the cardiovascular system. We'll probably discuss that with pedia. Ito naman age-related problems, meaning pagtanda mo, ito yung pwede mangyari, nagiging weak na yung venous valves, at risk ka for thrombophlebitis, nagkakaroon ka ng varicose veins, nagkakaroon ka ng arteriosclerosis, and it progresses hanggang mablock na yung blood flow. So kailangan monitored. So hypertension, it can also happen kasi nawala yung elasticity ng vessels. Remember, yung arteries mo can meron siyang tunica media na responsible in elasticity, pero as you grow older, nawawala yung elasticity. Siyempre, wear and tear process na rin, at saka kapag hindi mo nakakontrol yung hypertension. Just like anything that is elastic, nawawala yung elasticity. For example lang, sa rubber band, o kaya yung sa mga ladies, yung nagpo-ponytail kayo, di ba? Eventually, as time goes by, ginagamit mo lagi yung ponytail na yan, nawawala yung elasticity niya, lumuluwag na lang siya, no? So, ganun din nangyayari minsan sa vessels natin, arteries and veins. As we use it, tas tumanda na tayo, nawawala yung ganung elasticity, so hindi na siya nagre-respond masyado sa vasoconstriction and vasodilation. the coronary arteries becomes fatty and calcified, thus you will have coronary artery disease. Okay. That is the end of the cardiovascular system. Questions? Do you have any question?
Sa akin po, Doc.
Okay, JB, what's your question?
Yung friend ko po kasi nagtanong po sa akin.
Mm-hmm.
Ano daw po, kapag nag-straight body daw po siya, nahirapan daw po siya huminga. Mas
Okay.
parang comfortable po siya sa kapag nakaano po, kurbado po.
Pagka naka-straight body, hirap huminga?
Opo.
Okay. Yun lang, yun ang problem niya.
Opo.
Ayun, so pwede mo, sabihin mo sa kanya, pwede siya magpa-consult for, kasi pwede siyang friction rub, which means baka kulang yung fluids in between ng kanyang heart or lung, baka plural, it's either dun sa pleura or dun sa pericardium. Kaya pag nag-straight body siya, so mas nasa-straighten, so mas nagiging, mas na define yung pain. Another problem is baka may respiratory disorder siya, or isa pang problema is baka may scoliosis siya. So either way, kailangan niya magpa-check. Kasi hindi yun normal.
Okay po, thank you po.
Okay. Who else? Sino pa may question? Wala na? Okay. So if you don't have any questions, so let me check your Moodle. Moodle. Okay. So you will have midterms. Okay. Yes.
I-post niyo po ulit yung record niyo.
Yes. Sige. Para ma-review.
Opo.
Mabilis ba? Okay, sige. No problem. Tapos guys, so as you can see, wala na tong asynchronous, wala na siyang worksheet. Pero, wala pala sa muscular. Backwards kaya. Okay, so I'll give you a quiz dun sa quiz on cardio. Ito cardio. So magpa-quiz ako sa cardio. Madali lang. Yun lang mga diniscuss natin ngayon. Ipa-quiz ako sa cardio today, pero i-open ko siya hapon na. No? So you have like the whole morning to just, study. Okay? So open ko siya ng 11, tapos hanggang 5. No? So open ko siya ng 11 hanggang 5 p.m. You can access the quiz and you can, you can take the quiz. Yan. So you'll be given like 20 items lang. Tapos 30 minutes yung quiz. Okay ba yon? Para may quiz tayo. Kasi wala tayong quiz ngayong midterms. And next week, midterm exam. Okay? So, all about cardio lang. Okay? So, I will now stop the recording and